Hello, I'm Dr. Rekha Singh and I'm a senior consultant dermatologist at the Oliva Skin and Hair Clinic. We are often approached by our clients to address problems regarding sudden hair loss. It is common to lose around 50 to 100 strands of hair per day, but excessive hair loss with a specific pattern can be a sign of an underlying medical condition. The medical term for hair loss is alopecia, and when you experience patchy hair loss in a circular pattern, the condition is called alopecia areata. It is an autoimmune disorder and occurs when the body's immune system starts attacking the healthy hair follicles. However, with proper treatment, dermatologists can help regulate the immune system function, resulting in the regrowth of hair. Alopecia areata is one of the most widespread causes of hair loss, affecting nearly 2% of the population at some stage in their lives. About 147 million people across the globe are affected by alopecia areata and have a lifetime risk of 2.1%. Additionally, there are several subtypes of alopecia areata, namely alopecia totalis, alopecia universalis, diffused alopecia areata, and ophiasis. There is a chance you may have alopecia areata if you experience any of the following. You may witness your hair falling out in clumps during a shower or on your pillowcase when you wake up in the morning. Often, it is noted that hair fall from alopecia areata occurs in smooth, round, coin-sized patches that vary in size, sometimes leading to complete baldness. If you notice hair growing from the patches are narrow at the base in a way that resembles an exclamation mark. Sometimes, the very first sign of alopecia areata can be problems related to finger or toenails. The most common sign is spitting, where tiny dents form on the nails. The nails also become thin and rough and have white marks or stripes. Alopecia areata is an unpredictable condition subject to our immunological response, and no specific precautions can be taken to avoid it. There is no cure for alopecia areata as of now, but developments in dermatology have made effective treatments available to tackle this condition. Apart from assessing the previously mentioned signs, a dermatologist can perform a hair pull test at the consultation. A complete examination is done using a dermoscope, and if other autoimmune diseases are suspected, a skin biopsy and blood tests may be recommended. If you are suffering from alopecia areata, there are effective treatments and medicines available to help with hair regrowth. The duration of these treatments depends on the severity of the condition and can range anywhere from a few weeks to several months. Immunosuppressant corticosteroid injections are administered in the regions of hair loss. These suppress the immune responses that cause damage to the hair follicles. Often, this is the first treatment approach for alopecia areata, and it starts showing results as early as the 4th week. Extensive alopecia areata is treated using topical immunotherapy, which might take up to 3 months or longer to show results. It is a chemical application that induces dermatitis, which stimulates hair growth. Topical applications like minoxidil and anthralin can also be prescribed to be directly applied on the bald patches. For rapidly spreading alopecia areata, dermatologists may prescribe oral corticosteroids for a limited time to stabilize the condition. Risks and side effects related to the treatments may involve temporary depressions called DELs on the skin due to the corticosteroid injections, which fade over time. Topical immunotherapy may cause mild redness or a rash that gradually subsides. Minoxidil is a popular medicine with the least known side effects and is quite easy to use. Many treatments can encourage hair regrowth while afflicted with alopecia areata, but none have been proven to change the long-term progress of the disease. Since this is an erratic autoimmune condition, no particular treatment works for everyone, as it largely depends on an individual's immune system response. Depending on the case, individuals can expect hair regrowth within the first 3 sessions, which are performed at 3-week intervals. Often, people rely only on home remedies or natural methods to combat hair loss problems. These are not scientifically proven methods for hair regrowth. If you are rapidly losing hair in round patches from your scalp or any body part, please consult a professional. Alopecia areata is a genetic condition where a person inherits a specific set of genes from both their parents. Scientists also believe that environmental factors like stress also play a role in the onset of alopecia areata. Alopecia areata is not permanent as it does not damage the ability of hair follicles to grow back. Hair growth resumes once the immune function is restored. Alopecia areata is an autoimmune disorder and requires a holistic treatment solution. Usually, natural treatments, home remedies, and Ayurvedic methods are not as effective as a proper course of treatment suggested by an expert. Alopecia areata is mainly associated with the scalp, beard, eyebrows, eyelashes, etc. Patchy hair loss can also occur all over the body. While it is an autoimmune condition, there are still effective management options available provided you receive timely treatment. Book an appointment at the Oliva Skin and Hair Clinic by calling us or visiting our website.
Oliva is a leading chain of skin and hair clinics in South India. It has been ranked #1 in dermatology and trichology by Times of India. Oliva has also bagged many awards for its excellence in healthcare and wellness industry. Oliva boasts of the largest team of dermatotrichologists and world-class US FDA-approved equipment. The treatments are administered using rigorously tested protocols. Oliva is synonymous with scientifically backed holistic treatments that leads to satisfying results.